Hi, my name is Princess, and I'm a nurse practitioner student from United States University, and I'm going to do an abdominal exam on you. Is that okay?
Yes, that's okay.
Okay, can you tell me your name?
My name is Kendra Tete.
Okay, Kendra, Miss Kendra, I need your consent. Okay, so do you give me permission to record this video and put it on YouTube as unlisted so that my professor can grade me on that?
Yes, I give you consent.
Thank you. So I'm going to wash my hands, sanitize and wear gloves and provide privacy. Miss Kendra, can you lay down for me? Okay. And I'm going to put some pillow underneath you so that you can relax. Relax, okay? And I'm going to provide some privacy, okay? I'm just going to cover you up, okay? Okay, just put your hands and lift up your shirt for me. Okay. 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 So first, I am going to inspect the abdomen. Okay. I am going to look at the shape of the abdomen, the contour of it, the color, and this I can see that there is no lesion, any scar on the abdomen, and I'm going to look for pulsation on the aorta, and there is no pulsation, and I'm going to look for peristalsis, and I don't see any, and I am going to look at a sclera and see if like there is any jaundice, and I don't see any yellow color on this sclera, and I'm going to look at the abdomen, so there is no signs of jaundice, and the abdomen is not distended or like anything. So after that, I am going to listen to the abdomen. Okay, so I am going to start from the right lower quadrant to the right upper quadrant. Okay, Kendra, I am going to listen to your abdominal sound. Okay. So you should be hearing a vowel sound from 5 to 30. It's like a normal vowel sound, and it is normal. It's not hypo, it's not hyper. It is normal. And I'm going to listen to like our hepatic friction rub uh, by the kidney with the bell. And I'm going to listen to the splenic friction rub as well. Okay. With the bell. And now I'll be listening to the aorta with both the bell and the diaphragm. And the aorta branches into the renal artery and the iliac artery. So I'm going to listen to those also with my bell and the diaphragm as well. And I'm going to listen to the hepatic, and I'm going to listen to the femoral artery. So this is the right femoral artery. For like privacy's sake, I'm not going to remove her pants. With both the bell and the diaphragm. And this is the left femoral artery. So there is no bruit or like anything noted right now. So right now I am going to percuss. So Kendra, percussing means I am going to tap on my fingers on my stomach, okay, to listen to a tympanic sound. It's like a drum, okay. And I'm going to check to see like there is any masses or like anything somewhere, okay. So I am going to start from the right lower quadrant, okay. So all the 4 quadrants was like tympanic. There is no dullness in it. If you hear any dullness, that means you have fluids in your stomach or air, okay. So now I am going to percuss your going to look for the margin of your liver, okay, on the right upper quadrant, okay. So I am just going to move this up a little bit, Kendra, okay. So now I am going to percuss from the right upper quadrant so that I can see the margin of your liver, okay. You should hear dullness on the liver, okay. Okay, so this is the margin right here, and I'm going to go from the superior and look for the to percuss downwards and look for the margin, okay. Sorry, Kendra. So if you hear dullness, okay. So when to look for the margin of the liver, it should be from 4 to 7 centimeters, okay. And and the precaution should be dullness. The sound should be dullness. And for the spleen, you cannot percuss spleen because it is under the ribs. So, but like you should hear tympanic. But like if you hear any dullness, so if you hear any dullness, you tell the patient to take a deep breath. Can you take a deep breath for me? Until you hear a tympanic, dullness, okay. So dullness. So if you hear, until you hear tympanic. If you hear dullness, then that means the spleen has is been enlarged, okay. Breathe out. Okay. So now I am going to palpate, okay. So I am going to palpate. Do you have any pain anywhere in your stomach?
No,
okay. So if the patient has a pain, that's the last place you want to palpate. You don't want to start with the painful area first. So I'm going to palpate your abdomen. That means press down, okay, to see. I am going to start with a light palpation, okay, to check for any masses. Are you okay? Is there any pain?
No pain.
Feeling pain? Okay. Okay. So no pain. Okay, so now I am going to start with my deep palpation. So I am going to go deeper. Okay, I am going to start from the right lower quadrant. You okay?
Yes.
Okay. So no masses, nothing. There's no pain. I was looking at the patient to see that if like she feels any discomfort, but none of that was noted. Okay, so I am going to palpate your liver. Okay, so I am going to go deeper to see. Relax. Okay, relax. Okay, okay. So for the spleen, it's not palpable, but if like you are relaxed, it's not palpable, but if like you are able to feel the spleen, you will ask the patient to take a deep breath. So I take a deep breath. Okay. So I don't feel anything. So that means there is no sign of any enlargement or anything. So right now I am going to check for the morphine sign to check for gallbladder inflammation, which is called this thing, cholecystitis. Okay, so I am going to push down. Now I am going to do the morphine sign. Okay, so I'm going to push down deep, and if you feel any pain, let me know. Okay, so I will ask you to take a deep breath. Take a deep breath. Okay, do you feel any pain?
No.
So if the patient sees the breathing and the patient is in pain, that means it is positive. For when the morphine sign is positive, that means the patient has any inflammation in the gallbladder or the liver. Okay, and now I'll be checking for appendicitis. Okay, that means I'm going to do the rebound tenderness. Okay, so I am going to push down on the right lower quadrant. Okay, push down, and if you feel any pain, let me know. Okay, whether you feel the pain for me pushing down or like releasing, let me know. Okay, relax. Okay, okay, so I am going to check, do the rebound and tenderness to check for appendicitis. You feel
No
any
pain.
pain? Okay, so there is no pain now, and I am going to palpate your bladder. Okay, so to see any pain.
No pain.
No pain. Okay, okay. So now, okay, so now we've checked for the morphine sign. So I am going to do the flu shift test. Okay, if the patient has like ascites, that's how you check for the flu shift test. Okay, so I will have another desk with me by checking that to put the hands uh, the, in between the patient, not umbilical, um, then we do the test. So I can ask the patient to do that since I don't have any help right here. So for the flu shift test, and I'm going to put both my hands. My dominant hand is the right, will be on the left side. Then I am going to tap. So if I feel a wave on my right side, the right side of the patient, like a flu waves, then it is positive. Since the patient doesn't have any ascites, so it will be negative. So I am going to tap. Okay, So then if it's positive, if like there is fluid, you feel the wave on this side. Okay. And I am going to check for the CVA tenderness as well to check for kidney disorders. Okay, so Kendra, I will have you sit up for me. Okay. So for the CVA tenderness, you want to check for any inflammation or like any kidney disorder. So if it's positive, then the patient will feel pain. Okay. So Kendra, I am going to tap you. Okay. If you feel any pain, let me know. I know that you will feel the pressure for me tapping. Okay. But like if you feel pain, let me know. Okay. Any pain?
No pain.
No pain?
No pain.
Okay, so it is negative. Okay. So I think that's the end of my video, and thank you for allowing me to do my assessment on you.
You're
Okay.
welcome.
You can get up now.